Tulane Neurology is a program where residents rotate through 4 different sites. The main sites that they rotate through are University Medical Center, which is a large safety net hospital in downtown New Orleans, East Jefferson General Hospital, which is out in the suburbs, the VA Medical Center, which is across the street from UMC, and they also rotate through Children's Hospital as well.
Your first year is all internal medicine. You're completely integrated with the internal medicine department. Every 5 weeks, you'll visit the neurology department and get some clinic time as an outpatient doctor. And then starting your second year, you rotate through all the different neurology subspecialties.
They make it a point that no matter what rotation you're on, no matter how busy you're on, especially towards the beginning of your training in your second year, you make it at Actix every Monday. It's 1 to 5, lunch is oftentimes provided, which is awesome. And we get to learn about kind of the different aspects of neurology.
As the years go by, we get more and more elective time to kind of cater towards our own interest. We are also being structured to a more of a almost 50-50% outpatient and inpatient time.
We did a wide exposure to stroke, neurocritical care, but also we do a lot of general neurology. And there's always the saying in medicine where if you hear hoofbeats, you should look for horses, not zebras. We're fortunate in that we get to see the horses and the zebras in our program.
Our patient population is probably one of the best things that attracted me to the program. We do, fortunately and unfortunately, get a lot of pathology in New Orleans.
The patients you meet here are really interesting people. I've met some really cool people in my clinic, musicians, artists, other types of scholars and things like that. There's really all sorts of people here, and they have some really interesting stories and good recipes.
One reason I like this program so much is because I feel like the program leadership is very receptive to our input and continually solicits feedback from us so that we can kind of direct our program.
I think my favorite thing about this program is the people from top to bottom. I think we've got a really fantastic core of residents. We've got a wonderful group of attendings that are all very collegial. They all love to teach. They all want to be here and they want to work with residents.
It's a culture centered in working hard, but also like having a good balance between working hard and having time off and time to ourselves. There's not like a lot of separation between you and the attending. You like never feel nervous asking them questions. You never feel nervous clarifying things. And if you see like an issue or just like want some advice, I feel like very, very able to like ask for that, which has been really, really cool.
Anytime I ask somebody for help covering a shift, I've always been able to get coverage. People are very flexible.
You are never alone, you're never unsupported.
When I was looking for a program for residency, it was really important for me to be in a supportive environment where I could grow not only professionally but personally as well. And I feel like my program has really helped structure that. I was able to come out as my true self, and I've had nothing but positive support from all of my colleagues, whether that's attendings, co-residents, even the medicine department. If I had to choose again, I would absolutely choose to work with this group of people.
One of my favorite things about this program is our location in New Orleans. No matter where you do your residency, you're going to work hard and you're going to learn a lot. In New Orleans, there's always something interesting to be doing outside of work. It could be Tuesday evening and there's jazz music playing. There's going to be amazing restaurants. People here really live deliberately. They play music and they cook with their hearts. When they say hello to you and ask you how you're doing in the line in the grocery store, they actually mean that.
We have so much laughs. I cry with my patients when things are sad. I get to hold them through really tough diagnoses, tough procedures.
Treating people's strokes and watching them get better by the hour, I really can't think of anything that's more rewarding than that.
We're looking for residents who are good team players, who are interested in helping the underserved, who are interested in clinical neurology, but also in education and research and scholarship.
I would recommend applying to this program if you are looking for a small program in which you work closely with attendings, residents, fellows, and medical students. If you're looking for opportunities to teach medical students and conduct research, and also if you like music and food and dancing and sightseeing, New Orleans is a great place to live and practice medicine.